The landscape for treatment of early stage breast cancer that's HER2 positive has changed enormously over the last 5 years. The biggest changes come because of several large adjuvant trials that demonstrated that the drug Herceptin added to chemotherapy cuts the risk of relapse by nearly half in women with this particular subtype of breast cancer. It only makes up 20% of the breast cancers out there, but for these women this has been an enormous advantage in terms of improving their chance of cure and their outcome. What we will be seeing at San Antonio is an update of one of these large trials. And this particular trial is interesting because unlike the other trials, it actually had one arm that doesn't include the chemotherapy drug adriamycin or doxorubicin. That particular trial has been reported previously, and I think we're going to see the final update of it at this San Antonio this year. Another study in early stage HER2 positive breast cancer that's going to be presented here at San Antonio is actually a study called NCCTG 9831, which is a trial that's been reported in part previously. The part that's been previously reported was showing that Herceptin added to chemotherapy and after chemotherapy was better than just chemotherapy alone. What's going to be reported here for the first time is an arm of the study where women received chemotherapy followed by Herceptin. And the question, of course, is, do you need to give the Herceptin at the same time as the chemotherapy, or does it work just as well if you give it afterward? And we'll find out in a few days about that. Among the reasons that we're particularly interested in these two trials that are going to be presented is that one of the uncommon but real side effects of Herceptin is heart damage, cardiotoxicity. We know from other studies that risk is highest when the drug is given at the same time as other heart-damaging drugs, particularly adriamycin. And the question is, if it's given right after those drugs versus several weeks later, do you see an improvement in the heart? Let me say that again, sorry. One of the reasons that we're particularly interested in the outcome of these studies is because of one of the side effects of Herceptin can be damage to the heart. We know from the studies that have already been reported that that damage is highest when it's given with chemotherapy, and as opposed to after chemotherapy. Whether, of course, the drug works as well is the main question we have to answer. Whether we have a way of giving the drug that is just as useful but safer, or whether we have to balance the safety versus the efficacy of the drugs. Similarly, the regimen that's being studied in the BCIRG 006 trial that will be reported in its final version at this meeting has a regimen that doesn't include the doxorubicin drug at all, and we know that that one is considerably safer to the heart. There's been a question that's out there about whether it's as good as the regimens that include doxorubicin. We'll find out in a few days. So women with advanced HER2 positive breast cancer have also had the benefit of a number of great advances over the last few years. In particular, in addition to the drug Herceptin that's made such a difference in early stage HER2 positive breast cancer, we have drugs like Carey, which we know it works very well even when Herceptin hasn't worked. And the question is, what about drugs after that? And there are several very exciting compounds that are being evaluated right now. We know, for example, that it looks like you may be able to get better effectiveness if you combine drugs that target the HER2 protein. And there'll be an update at this meeting of a combination of Carey with Herceptin after patients have already had progression of their disease on Herceptin. And I believe that they're going to be presenting survival data from that study, which will be very exciting for women with this disease. There will also be some updates of some of our more exciting agents, such as a drug called TDM1, which is actually a drug that takes Herceptin and uses it as sort of a Trojan horse to deliver a chemotherapy agent, and maybe a very safe way of delivering chemotherapy directly to the cancer cells.